Hi guys, Dr. Dilip here, your internal medicine faculty at Cerebellum. Right now with me, Dr. Harsh, who has scored a very good rank of 1957 in the recent INI. Welcome, Dr. Harsh.
Thank you, sir. Good evening, sir.
Good evening.
Sir, I've been
Uh,
like your fan since final year, sir.
Thank you
Like
so
I've
much.
been studying medicine from you. Like I've completed it whole, the main videos. I loved them. I revised them, and medicine was a good for
Yeah,
me.
but still you wanted to become a psychiatrist because you have
Yes,
been
sir.
exposed to a lot of psychiatry.
Yes, sir. Like in our college, we have postings there in second year, third year, and then again in internship. So it's a good exposure there.
Good exposure there. So
Yes,
anyway,
sir.
first of all, congratulations for the fact that you will be ending up with psychiatry
Yes, sir. Thank you, sir.
and I'm wishing you all the best for the same.
Yes, sir. Thank you very much, sir.
And I want to know about your preparation phase. So how did you split your preparation phase?
Sir, I started in the final year itself. Sir,
Okay.
in final year, I started with the medicine. So
Okay.
my very first topic from you was the acid-base imbalance. The
Okay.
very first topic I read, and after that, when I was posted in emergency medicine, like we need to do ABG again and again. So I was using those formulas again and again, applying those and asking my seniors what is right or wrong, I'm thinking correct or not. So that was the my very plus point in every exam. So after that, I've done my final year, and after completing my final year, I took a break of 7 days before my internship started. And with internship, I managed to study 4 to 5 hours daily basis, depending on the department I've been posted. Some were hectic, some were easygoing. So the hours varied between the 5 to 10 hours a day. There were
Okay.
days when I was not able to study, but all right, it's all right. Sometimes we need to go for nights and those long intensive duties. But yeah, I did during the internship. So with my internship attempt, I got a rank of 10,000. Then I was revising the subjects. I was happy कि first attempt 10,000 is okay. I might improve in May I know. But sir, then a sudden blow came. Instead of marks, the rank got doubled. So it was like a blow. कि I've been studying for 6 months, and then, sir, there was a delay in NEET PG exam.
Yeah.
So, so I was happy about that. कि yes, I got the time to study more. So I did the NEET PG, and the day NEET PG ended, next day I continued my preparation. I didn't stop there because I was not sure what it might be. It might not be in favor. So I studied till the INICET November. I gave this attempt. Then I came back to my college with friends to enjoy the 7 day before the result comes. And now I'm in my college only. Now I'll be leaving for home. And I was happy at the night. We friends were there, 7 to 10 friends, and we were celebrating. And sir, I did main videos that I was lacking confidence in some subjects. Like I was weak in sir anatomy, I was weak in pathology, but I did very well in pathology. Sooner or later, I developed questions after solving questions and revision. But for some subjects, I went with BTR only because it's less time consuming. Some were short subjects, but major subjects that are high weightage in INI, I did it from main videos. And also, I did it from BTR also. I keep on revising and switching between the two and doing questions. So when I was doing PYQ, I tend to read the questions wrong. Sometimes, like our brain thinks ki this is the answer, and we jump to the answer. Ki yeah, this is the answer. Then it goes wrong. So I used to do the 50 question set, and then I used to look into my notes ki where I did go wrong, because I knew the concept theory, but sometimes we apply it wrongly to do that. So I continued this trend, and then I was preparing again and again. And sir, mission classes tests, the subject wise tests were so good. Those were, sir, previous year topic based. Only this slight twist in the words and the question went wrong. So that was the very help, sir. Like in many subjects, it was like a boom. The sir, after 120 correct, it's very hard to improve again after theory revising. So it comes to the question applying. Sir, your medicine paper, sir. Like sometimes it happens, it goes wrong, and we curse from inside. Ki, yeah, why he is making so hard paper? And then in the November INI paper, I was thankful. Thank you, sir, for making such a paper. Ki we get a gist of tough questions. Ki it might come in INI. So, sir, this INI was a language twister rather than a core, and they went vertically deep inside. They were asking epigenetics, but this time they went to epigenetic drugs. So that's how I was happy in the paper because the question paper was tough. So I was like, it's better to leave the questions rather than attempting to a large number. So, sir, I attempted 182 questions,
Hmm.
and I left those questions that I didn't knew or I was confused in the three options. But in the questions where I was confused in the two options, I attempted it, took the risk. So, sir, till now I don't know the corrects, how many corrects I got, but in the
That's
recall I was
okay.
getting.
I was about to ask the same thing. You attempted 182.
Yes,
My
sir.
guess would have been if you have got 195 maybe. So if you have attempted up to 194, 195, I think you would have got even a better rank, I feel.
Yes, sir, might be possible, but
I
in
mean, yeah,
exam.
it's just an like
Yes, sir.
hindsight, I would say. Like
Yes, sir.
in reality, hindsights don't work. So, but
Yes, sir.
anyway, it's just a hindsight, I say. Like maybe if you have gone for 195, maybe the full Monty, probably you would have got maybe even two, three extra, right? That could have made a big difference, maybe.
Yes, sir. Might be possibility, but in the exam we think, ki, okay, it's better to leave this question. I might go
Yeah,
wrong.
anxiety, yeah.
Yeah, it happens in paper, sir. And sir, in anxiety, people get tremors and all, palpitations. I don't get any of this. Only my gut start moving. That's an issue in exam center, sir. It is happening with me since like UG exams.
No, no, that happens to everyone almost. So not
Yes,
only
sir.
you,
I need to visit
but
the
but some people get more, I mean, something more than
yeah.
the other.
Yes, sir. That's definitely true. So it was like, but in the NEET, I was getting psychiatry. In like, I'll get my state top college might be a possibility,
So you want to get
95%.
psychiatry, NEET or INA, maybe you will decide that later on. That's what I
Yes, sir.
said.
Yes,
And
sir.
what is the lowest point of your preparation, and how did you struggle, and how did you get back?
So that was the May INICET exam, where after studying for 6 months, I got a rank of like rank got double 10 to 20K directly. So that was a blow. I was like, "Okay, what
So
happened?"
that's the
I
lowest
took a
point of your preparation,
yes,
right?
sir. Yes, sir. That time took a break of a day. I slept whole day, like did nothing at all. I slept for a whole day and made my mind. It's okay. It happened. It won't happen again. I will look at my mistakes where I go wrong and correct them. And subsequently, it went well in the INI. So I might decide where to go, but yeah, I'll be taking from these two only.
Okay. So in the
Yes, sir.
exam hall, how did you manage time? Because nowadays people are doing it in blocks,
Yes, sir.
right? So that's a kind of a struggle because most of the people are losing a lot of questions just because of that block-wise timer. So
Yes,
how did
sir.
you?
I also did lose those questions. Like I lost
I
five
mean,
questions.
what is your? I mean, maybe even if you have lost some questions, what will be your strategy to get rid of that?
Yes, sir. I tend to do the thing in the GTs where I never ever got the delay in the set. What I did, ki I look at the 10 questions and I see if I complete it
No, the
within the.
problem at the GTs and the real exam is in GTs, sometimes you might be a bit cool,
Yes,
but
sir.
in the real exam, like you want to be a little extra cautious.
Yes, sir. Anxiety kicks in. Like
Yeah,
you
and you
tend to
want
forget
people
the
want to be
thing.
extra cautious, right? They just
Yes,
wanted
sir.
to spend a bit more time. They wanted to read in between the lines, and they keep reading the same line two, three times again and again.
Yes,
So,
sir.
but we
That
don't
happens.
do that much in the GTs
No, sir. We don't do that.
compared
It
to the
happens.
real exam.
Yeah, sir. What I did was ki I read the options first rather than the long question step. I read the options ki what they want me to find out in the question, so that while reading the question, I can just rule out the options while reading it. Okay, yeah, this is not the answer. This is not the answer. This is not the answer. So lives with it, and I don't apply extra logics into it because sir, it happens. The first we think is the correct answer, but then another train of thought comes in the mind. Okay, no, 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 no. This might be wrong. This might be the correct answer, and then we change the answer. So, sir,
Ah,
I
that was also. I mean, I was about to ask that in the past itself. Many times you get stuck between two options or three options sometimes.
yes, sir.
How to tackle that? You want to go with your intuition or you wanted to just
Sir,
experiment scientifically?
gut feel. I went
Gut
with
feel,
the gut feel. Yeah,
gut feel and the
or
intuition.
yes, sir. Or if some options are like that, ki we can like break the words. Ki yeah, this might be the logical word. This might not be the option. Breaking the words or taking the history into consideration, age factors and all those. But mostly gut feel. Ki yeah, I'm thinking first this came to mind. This might be the correct answer. Second train of thought is mostly wrong for me. So I go with the first train of thought.
If you want to do something differently in your
Yes,
preparation journey,
yes,
what
sir.
you would think like should have been different? I mean, if you want to change something in your journey, so what do you think you should change?
Sir, like if I think I can change like n number of things. There are a lot of things.
What's the most
Everyone tells
important
me,
thing that you want to change?
yes, sir. What happened with me? कि I'm the person who thinks कि first make the theory strong and then do the MCQ.
Hmm.
And that took me a year to get there कि I know the theory. But I should have done the MCQ, doing the MCQs before only.
Hmm.
I did it a bit late. So my PYQ revisions were a bit less. So in the NEET exam, it would have been great help if I would have done more revisions of PYQ. The midnight series. I always think, कि, yeah, today it's starting. I will do it together. Then what happens? 10 days I do. Then comes a day I misses it. Then a backlog creates and it keeps on happening. So I was not able to do the PYQs as such in the depth, but I took the two revisions. But if I would have done the more a depth version, then it might be a possibility. Rest
Okay.
I did the revisions very well.
Okay. So,
Yes, sir.
what is the one bad habit that you don't like in yourself?
For me, sir, what happens with me is like there is a rule in psychiatric study for 30 minutes, take a 2 minutes, 5 minutes break, study for 30 minutes. I don't do that.
So, something like a Pomodoro.
What I do, I'm watching phone, then I get time, I study. Then I'm watching phone, then I get time, I study. So that was my bad habit. It took a lot of like hard work to get rid of it. There to make it like study and a bit of a phone rather than a
That's a
more of a
valid thing
phone and a
because
bit of
even
study.
most of the adults right now are hooked to the phone.
Yes, sir.
It's very difficult to
Definitely.
remove that phone addiction. For
Yes, sir.
nothing, people see phone. Like they just see Instagram for no reason. They just see WhatsApp for
Yes,
no reason.
yes, sir.
But
I
they
got
want to
rid of
see.
Instagram only. I got rid
Yeah.
of it. That was the like help,
No,
but
and most importantly, you should get rid of the YouTube also because the YouTube shorts also waste a lot of time.
yes, sir. I don't watch YouTube. I was never addicted to YouTube.
No, no. People
Like
who don't watch Instagram ultimately end up watching YouTube shorts.
YouTube thoughts. But sir, what I did was I made a rule कि I will study from tablet. Tablet was not having any other app. I was having a Cerebellum app, a writing app, and went to Google to just search the things I need to search. Like if I'm reading about the hernias, I need to search the images. कि how does it look in the OT room? So I did that. So it was a rule. When I'm studying with a tab, I won't look at the mobile phone. So I did a separate device for study. If I'm using
Mhm.
this device, I need to study. If I'm using this device, so I need to do whatever I want to do. So in the April Feb, the Cerebellum was launching, about to launch. So pre-launching offer was there. So I was like, let's join a coaching. Let's see. If I invest some money, I might study. That a thought came inside me. So I just randomly downloaded the app. So till that time, your videos were on the upload. It was uploading 1 2 videos daily, going like that. So I was watching that time surgery, Amritsar, and sir, he was good. I watched half surgery in English. Then the sir's English version came, and
Okay.
Hindi version of sir was so great. It felt like okay, sir is talking like this. Okay, if this happens, what you will do? Yeah, you will do this only, no? Why do these things? So the logical way of his teaching was like, okay, surgery is also doable. Then surgery came. Your medicine, sir, it was uploaded a quite bit late. But yeah, I started in April, May. May I was started with the medicine. Till that time, I have done surgery, OBG. I was completed with those things and remaining with the pedia and the medicine. So I did pedia. Then, sir, your extra advantage series came on later on.
Yeah. We did the
And
infections and we did the valvular
yeah,
heart disease and all.
valvular heart disease, sir. I did it from there. Then the concept of like the plethora in the lung, why there is plethora, why there is oligemia, why the sound is heard here. Sir, I've done your main videos. Na? In extra advantage, you have told the mechanism behind the murmur. Why does it radiate to there? Ki there is a form of whirlpool like thing and jet goes there. Ki why in MS this happens? Those reasons like sir in AR the regurgitation flow also can hit on the mitral walls also. Those mechanisms you taught sir were like a really a great help. And I plays with the
Yeah,
words
that's the
only.
whole reason why the GTs were supposed to be a bit tough when it comes to INI.
Yes sir.
How did you feel
Definitely.
the Cerebellum GTs?
Sir, initially what happened was, sir, there was a platform already established. Okay, Mero was there already. So GTs were there. Initially, the Cerebellum GTs were a bit of the tech. Then slowly, teachers were working on it. I gave the GT in the internship. One GT I gave there. Then I realized, okay, these were some previous year questions that were twisted around. Then by the time, sir, these GT in the Jan 2025 to like whole cycle, those GTs were amazing when you started with the video solutions. That was the amazing boom, sir. After that, I'm not remembering I have given the other platform GT. I was constantly giving Cerebellum GTs. And those were so PYQ oriented. I was happy with it.
Now it's time for rapid fire. I'll be asking some rapid fire questions.
Yes, sir.
What's your most lovable subject?
Sir, pathology.
So which subject you find it the most easiest?
Most easiest, sir, most easiest for me was physiology.
Physiology. Okay. Which subject
Yeah.
you found it to be like extremely challenging?
Sir, anatomy. I don't like it.
Anatomy.
Yeah.
Which subject you feel it the most trickiest?
Medicine, sir. No doubt about it.
Medicine. Which
Yes, sir.
subject you hate the most?
Anatomy.
Again. So
Yes,
which
sir.
subject you felt it's very tough, but you did surprisingly well in the exam?
Sir, for me, orthopedics was quite tough because since my anatomy is weak, I don't know the nerve supplies, I don't know the
But you
fracture
did
name.
very well in the exam.
Sir, in this INI, according to recall, I got zero wrong in the orthopedics. I
That's
don't know
great.
how it happened, but it happened.
So one quick study hack that you want to tell to others.
One quick study hack, revise it multiple times, do the previous year question, previous year topics, and go vertically deep if you are preparing for INICET or for NEET PG. Keep on reading extra things also because NEET PG might ask anything, but INI tend to ask more of the previous year topics and go vertically deep in.
Mhm.
So that's the hack for the both exams. What I think.
Okay. Apart from that, like, do you think like anyone in 6 months' time crack INICET?
Sir, it depends. One of my friend has done it. Like if it depends ki how much you have done in MBBS. If you have passed your exams on yourself, like there are other ways to pass also, but if you have done it on yourself, then if you study for 6 months, you can crack it. Sir, one of
You
my
can
friend
crack
has
it. So
done
your
it.
answer is yes. If you have studied well
Yes,
during
sir.
your undergraduation, it's fine. It's yes,
It's fine.
100%.
It's doable.
Okay. It's very much doable. Okay.
Yeah.
We have come to the
Yes,
end of
sir.
the interview. Thank you so much, Dr. Harsh.
Thank you,
Wishing you
sir.
all the very best. Wishing you a great career ahead. It's been quite a fantastic interview, I feel, because you have said a lot of things that are very practical that can be applied in day-to-day life also. So that will be a
Thank you, sir.
take-home message to a lot of other students. We as a part of Team Cerebellum are proud of you and we are very happy that you are here.
Thank you so much, sir.